And of course, it comes with ego that, I'm better than everyone. I'm the best dentist there is. I'm better than the nurse and the receptionist. What do they know? They didn't go to uni. And it's like, yeah, it's probably not going to get you far having that sort of attitude. So work with people.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. Hey guys, I'm your host Laurence Doan. Today we are joined by Dr Sandra Pedram. Sandra graduated from the University of Sydney 24 years ago. She has worked in a variety of practices across Sydney and currently works in 2 locations in the North Shore of Sydney. She has done extensive continuing education in orthodontics, cosmetic dentistry, facial aesthetics, and communication. Dr. Sandra Pedram, welcome to the show.
Thank you for having me.
So, you're coming out of lockdown around this time of recording, and how have virtual consults been for you?
Look, essentially we sent out emails and whatnot to the patient base to see if there was much interest in tapping into that. And we did very few. I think most people either would prefer to come in face-to-face or delay it until they were allowed to come in. So I'd say I have minimal experience with virtual consults, but we did offer it. So yeah.
So, your CPD journey into developing an expertise in orthodontics and cosmetic dentistry, facial aesthetics, and all of communication, how'd that all kind of come about?
Look, I think, probably fairly early on from graduating, you work out that the journey of learning has just begun. As they say, the good old joke of you're practicing dentistry. So certainly every day is a learning curve. I think with that attitude, you realize that you've got to fill in all the gaps and all the interests that you might have along the way, and, do studies in initially probably what you think you're interested in, and then as you attend more and more courses, you can sort of narrow down your interest levels to some degree.
Right. And so how did that change from when you were graduating as the student president at the time to what's developed now? Where were your interests initially, and how did that kind of change?
Well, I think certainly, as you mentioned, I've done extensive, studies in orthodontics. I've done many courses. Part of that probably was the frustration that I seem to recall we had 1, maybe 2 lectures in orthodontics, and we were all just left so hungry for more knowledge. And, we did, half the course seemed to be on how to make a denture or, how to do an amalgam filling and stuff that, like, within the first months, you realize you're never going to do. So it certainly was to fill the gaps that I felt I had in my knowledge to begin with. And, most of us growing up in Sydney have been privileged enough to have had orthodontics ourselves. So there's always an element of curiosity there, I guess, as to how it all panned out and why the orthodontist made some decisions that they did at the time. And yeah, that's probably one of the reasons why I was very attracted to doing orthodontics to begin with.
Right, yeah. So were you doing like weekend kind of courses beforehand, or because you didn't quite jump straight into that straight away, right? There was a few years where you were focusing on a few other things before you jumped straight into orthodontics, right?
Yeah, so I had about 3 years where I worked in my first practice out west, and I was hungry. I was hungry for the work. I was hungry to earn money. We can all relate to having gone through the extensive degree that dentistry is all about, and you just want to pop out at the other end and just, you've got your L plates and training wheels off and you just want to fly. So the first 3 years was just working like 6 days a week, 10, 12 hours a day. It was pretty much like an internship, just, learn as much as I could. And I was very lucky, the practice owner certainly was very busy himself. So there was plenty of work to go around. And working out west, you also get to do lots of extractions and lots of things that you might not be exposed to in sort of more I guess richer suburbs, so to say. So yeah, the first 3 years was just doing lots of stuff, and then from there I changed the location at which I was working in, and I think that just opened my eyes to a very different style of practice. And yes, they were doing orthodontics there. So, I was very curious, general dentist doing lots of orthodontics. And, he was also very generous with his time and knowledge and very supportive of me doing something like ortho, and that definitely helped the journey. There was equipment already there, you know, all the pliers, brackets, mentorship, all the things that I needed to sort of get it off the ground. And yeah, that was the first sort of long course I did, which was the POS, which you might be familiar with.
Right, so basically you picked this one because, I mean, at the time there's probably a few different orthodontic courses out there at that time, right? But you picked this one in particular because that was what your mentor was doing at the time and that was the system that he was familiar with?
No, actually, I don't seem to recall many other options, to be honest. That was almost, 21 years ago. There wasn't any extensive program like there is now. And it was also, I'd already done the Skip through it sort of weekend courses. So I'd already doubled a bit in ortho, and definitely the interest level was there. And yeah, POS, from what I remember, was pretty much the only proper 2-year program where, you know, you could sort of, someone was there to tap into their knowledge, hold your hand, and you felt like, you know, you were learning something from the beginning, not just like a weekend course where, of course, that's nowhere near enough to actually do any proper treatment. So yeah, that was probably the main reason that I did it. And I think, yeah, I do seem to recall that the owner of the practice I was in had done POS. That probably was one of the recommendations, one of the, you know, people to say, yeah, this is a good course, you'll get this much out of it. So yeah, I think the course is still around from what I know, that people still do it. And
yes, it is still around. Yeah. But that didn't stop, your ortho education didn't really stop there. It continued.
Yeah, and you know, I mean, you'd hope that once you start doing a particular type of dentistry that, you know, you only want to keep adding to that knowledge. I mean, it's always nice to be privileged enough to learn on patients, which is effectively what you tend to do when you're practicing dentistry. But you know, as soon as you start doing something, you realize that you want to learn more about it, so you can keep improving and, you know, give the absolute best treatment you can to patients. I mean, I think you would have your head in the sand to say a 2-year course in orthodontics is all you're ever going to need to be a good clinician at it. So, and also things started to rapidly develop in Sydney in terms of the style of orthodontics that was being taught. So a lot of the other programs now on offer are far more early treatment focused, which you know, certainly gravitated with me, and that was, you know, the EODO program, and even Skip through it at the time was doing a lot of functional appliances and you know, teaching sort of early treatment than what I guess we would have been taught at uni.
Right. And did you find that there was much? What were the differences that you noticed because you've been able to attend, you know, the 2 different programs?
I did them almost 10 plus years apart. So it was also, I was at a very different stage of my career. By the time I came to doing the EODO, you know, I'd already had over 100 ortho cases under my belt. So it was probably good doing EODO like that. You know, there's so much content and information in that course, taught by Derek Mahoney, of course. And yeah, you know, it certainly has a very early treatment focus to it, which was great. So to answer your question, yeah, they're very different. POS has a variety of teachers that used to fly out from the States. So I guess you also had a lot of different teaching styles, which, you know, can be good and bad. And Derek Mahoney, I mean, he's such a dynamic speaker. I think anyone who's ever heard him speak can get, you know, so much out of his courses. He's fun, he's dynamic, you know, you learn lots about everything, really. So I enjoyed it on that element too. And of course, the people you meet at the courses, you know, it became like a little family. Doing a 2-year program in whatever it might be, you start to form some close friendships pretty early in the piece. And, you know, you look forward to going and seeing them on the monthly lectures as much as you do in what you're going to learn. So that aspect of it was really nice.
Right. So basically you've graduated and you're just dabbling in, you're putting your head down, you're just trying to get through as you're getting your hands wet and getting that experience, and then you've moved out to another practice and they're doing ortho, and that's why you decided to pick up ortho. So whilst this is all kind of happening, you mentioned there was a gap in between the 2 programs. So what were did you dabble in other things at that time?
Oh yeah, definitely. I mean, that was sort of more where all the cosmetic dentistry journey began. At the time, the second practice I was in, the LVI phase was going through Sydney. I'm not sure if you're familiar with that institution.
Yes.
Yeah.
Yeah, it's
So
very big over in the US, and a lot of people who are getting in the cosmetic is just going over there.
yeah, so that was a really good learning curve as well, and picked up a lot from those courses. And then, of course, there was the OLMOS that sort of weaved in quite well with the ortho and the tensing of the muscles and whatnot. So there's a lot of overlap with the courses, and I found that once you go to one program, you start to learn about the courses, especially through the colleagues that you're there with. You start to hear what they think about the courses that they've also done, and the relevance to what you're currently learning in that program as to what you should do next. So to be honest, normally you're sitting there listening to the lecture, planning your next CPD journey, because it sort of piggybacks on the one you're in. Which is really nice. It also, motivates you to just keep going, finish this course right, maybe have a bit of a breather, save up a bit more money, and then jump into the next one. So yeah, I think, it sort of ties in quite well. And as you can imagine, ortho is the foundation for so much of dentistry. And I think I was really blessed to have done it early in my career to try and ensure that, I understand how to make dentistry last a long time too. And I think, without understanding occlusion and of course, everyone thinks, oh, well, what's there to it? Everyone knows class 1, class 2, class 3. But I think when you start to actually do ortho, you start to see what difference you can make in, people's dentistry with just changing their bite. And I think that's a beautiful thing, to be able to always offer patients first. And if you know how to do it and you're passionate about it, it's not that hard to convince them, because they sense the passion, they sense the urgency. And I think that's a good thing for everyone. It makes your dentistry last. It means that the patient's getting absolute best care, because you don't have to take as much tooth structure away, etc. So yeah, I think the two go together really well.
I'm just listening to what you're saying, and I'm thinking that for a lot of recent grads, when they graduate, they feel like, I got to learn ortho very quickly. I got to go learn implants very quickly. I want to do all of these things very quickly, and I'll do it at the same time. Would you say that would you recommend that graduates get into orthodontics earlier on, or do you think, just get your bread and butter stuff sorted out first before you kind of get into the orthodontics? Because you're saying, having understood it, you understand more about how you make things last for longer.
Yeah, I mean, there's an element of that, but you can probably do a weekend course if that's the only reason you want to know about ortho, and really understand occlusion, and then move on and do whatever you like. I mean, I think the answer to that question is, you've also got to be conscious that, you've got the right skills to get people to come back and see you. And, part of my big journey in dentistry has been supplementing. For each course I do in dentistry, I try and focus on myself, as a communicator, as a people's person, as, as part of a team, which is essentially so important to be able to get your patients to come back and want to see you. So, I think, sure, if you're a recent graduate and you've got time and money and you want to do lots of courses, there's nothing wrong with that. But essentially, if you do a 2-year program and, you're only seeing 1 or 2 patients a day, and you're struggling to convince patients to come back and see you for a 6-month checkup, then I think it's a big jump to then present like a $10,000 orthodontic treatment to them and have them accept. So, the challenge there is, you might have all the knowledge, but then you might not have the skills to actually, jump that across to practical experience, which you're going to need. I mean, we all take away so much from courses, but unless you sort of start to do the work pretty quickly after the course, the knowledge is not to the same level 10 years down the track to pull up your notes and say, right, now what did I learn 10 years ago? I finally got that case locked in. Let's go. Let's do it. So I think it's got to be, you're right in it. You've got enough patients that, will accept your treatment plans and want to do the sort of dentistry that you've just learned to the course.
You mentioned communication. So tell me how you kind of built on that.
Look, I think, again, I was pretty lucky to already have pretty good communication. I actually put it down to having a part-time job from the moment I turned 14 and 9 months. I was one of those teenagers that was just so hungry for money, and I worked in like Grace Brothers and bakeries and all those sorts of places, and I guess talking to people, just it had to happen. It just became a natural thing. Any age, any gender, any whatever, they're in front of you, you got to talk to them. So I felt quite blessed to already have pretty good skills on that front, and I guess it sort of made me want to do more and more, because there was also the interest. When you're already a little bit good at something, you become more interested in it. And so there's so much around. There's so many books on communication. There's so much, information on even just human psychology. And I've always been drawn to those sorts of articles and books and journals and YouTubes and all of that. I've done formal courses, like I did the 12 months hypnosis course that was tied in with the New South Wales psychology sort of degree, and that was really good. I took what I could out of it, and obviously added it into my work at the time, and yeah.
Right. Well, tell us about that. So the hypnotherapy one. How did that kind of come into, like, oh, this is something I want to consider doing?
Someone had done the course, so that's how I knew about it, and they mentioned it to me, and so I looked into it, and it just looked like a really interesting program. And to be honest, if it was going to make zero difference to my dentistry, I still would have done it, because I was so drawn to studying about psychology, and I didn't obviously want to sign up to a 6-year uni degree after finishing dentistry. So it was a really good journey. It was like similar to all the ortho programs, like 1 weekend a month and then lots of homework in between. And it probably taught me a lot about psychology. And sure, we did actual hypnosis on each other, and we no one walked across the road as a chicken or any of that stuff that people assume is to do with hypnosis. But yeah, there was a lot of indirect stuff that I learned through it as well, with language and how you put words together to communicate more effectively to people. And so I'd say what I got most out of it was all the indirect Ericksonian style of communication, particularly around treating children. That was a game changer. I remember how much I disliked treating children initially in my career, and I was young, obviously didn't have any kids of my own, but doing that course taught me how you can just flip things around, and how you can get a child to sit still for you and open their mouth, and it's just the words you throw at them. It's got nothing to do with what kind of a dentist you are. So yeah.
That is interesting. Yeah, because obviously at this point, you've decided to pick up ortho, and so a large probably percentage of the people that you're probably going to be seeing are kids, and you have to be comfortable and managing these patients, right? So, you need to have the skills to be able to manage these patients at the same time.
Yeah, absolutely. And look, as I did the early treatment stuff, sometimes you're treating them very early on. If you're going to get them to wear a Myo brace or a munchie and all those appliances, like you're dealing with 3, 4, 5-year-olds, but also parents are always watching. In my experience, often the phobic adult patients send their little Johnny in first, and they're sitting there watching. They want to see what kind of a dentist you are. So it's a show. Like, the show is on for every patient, every new patient. You have to show them who you are, and sadly, they don't care about your margins or the color of your composites. They just care about your personality, and they care about how you treat their little precious humans in their life. And so yeah, often it's the child or vice versa. Mum might be a patient of yours, and of course she's going to bring her whole family to you. And I think I've been really lucky to work in practices where they're probably in suburbs in Sydney, where there's strong family networks, and people start to trust you, and then you get to see the entire family. And that's a dynamic that teaches you so much about life, not just dentistry.
Right. And so all this is all, so you back to like the orthodontics just for a second. So you're learning about all of these different types of fixed linguals, and then clear aligners is coming up on the up and coming, right? and it's something that's probably initially wasn't taught so much. So you're seeing that on the horizon, and that's probably incorporated into the program as well. I think the second program that you're the EODO, is that right? At that time, or it wasn't quite yet?
Not really. No, actually, no. The ortho programs I've done, I haven't done any official clear aligner program. I've gone to the symposiums, and I've done a lot of the Invisalign courses they offer, but that's more like 1 day, 4 day, you know, that sort of thing. But I've never done like a 12-month, 2-year clear aligner program. But to be honest, it's basically technology that you have to be taught. There's, you know, if you know how to do fixed braces, it's the same stuff. It's just you have to know how to navigate Invisalign software or ClearCorrect software. So I think if you do fixed first, you can't go wrong doing clear aligners. Probably the other way, you know, if you just dive in and do clear aligners, you know, sure, probably most of the time it might work out, but you know, it's always nice to have the knowledge of, you know, when to wear elastics and the force of elastics and, you know, just all of that, like when to intrude teeth and when to extrude them and how that makes a difference for a beautiful smile, and curve of spee and all these things that, you know, you get taught in a sort of a more comprehensive program.
Yeah, because like I was just going to ask, a lot of graduates come out and they see like these clear aligners programs, and they're like, well, I don't know, is there really a need for that amongst my patients to want that? Like, do I need to get my head into that space of fixed aligners? But like you've just mentioned, it's important that you understand the fundamentals before you kind of jump into something that may be a little bit more limited in terms of knowledge and scope of what they can do. So then, you know, sleep apnea or sleep medicine starts to come up on the up and coming as well. So talk to me about how you kind of dive into that now.
That was actually, that was such a fun course to do, because in some ways, you know, having had the 10 plus years of ortho experience and having done the 2 different types of ortho courses, it was definitely the finishing course for the orthodontic journey, because a lot of sleep apnea is, you know, all the research shows it's to do with the position of the mandible and, you know, a trapped mandible, etc. So I'd started making those appliances a long time ago, and I guess, you know, you start to get fearful of permanent bite changes, and you know, once you see it and you've experienced it yourself, you know, you sort of think, oh, is this really worth it? You know, someone's bite's so important to me, but of course the patients love the appliances and don't care about their bite changing. But yeah, it just made so much sense to do the course, and I guess it's probably changed my 011 or 012 type examination to far more than just teeth, and I think that's really nice too. And you know, it's sort of, you know, as they say, all dentists want to be doctors, right? Like, you know, no one, people didn't get into medicine, so they went into dentistry. And I think it's a fun thing, right? It's also fun to help people. It's very rewarding. You know, if you see it, you diagnose it, you tell them about it. Sadly, not every patient's interested. You know, you can spend half an hour explaining it to them, and they might look at you and say, I'm just here for that, you know, veneer. I don't want to have anything to do with my airway. And so I guess that's also a skill to learn how to communicate to patients about their ill health at what stage of their dental journey with you. Because, you know, if they're not in your chair for sleep apnea, I've just learned it's not the first thing you want to be throwing at them. You know, you've got to manage what they're there for first and get them on your side, and then hopefully help them with their health journey as well. And then, you know, they love you for life. They will definitely become your patients and follow you wherever you go. You know, that's a huge impact you can have on someone's health.
I see. And then after this is all kind of finished, I mean, and then there's this injectable things kind of coming about. Is that right? Around this time frame?
Yeah, the injectables was, I think just prior to the EODO. It was just when it had started, probably like I was maybe the second year that that first program was teaching it. So I did jump on that pretty quickly as well. And yeah, again, good fun, you know. I think most dentists, tend to do it a lot at first, and then they probably become more picky with what they do. And but you know, it's a good adjunct to your knowledge. It really helps with gummy smile treatment. So you know, especially the cosmetic work, it's such a good thing to be able to offer patients rather than, you know, a Lefort one or whatever. Like, you know, who would choose that if you can just help them with 2 little injections? So yeah, I do enjoy that side of it, being able to have it in my tool belt to, you know, offer it to patients to finish things up.
Yeah, I guess it is tricky. I mean, when you're explaining it to a patient, like explaining a Lefort one, they're like, "What is going on right now?" Like, yeah, I can see what you're saying. What are your thoughts on recent graduates wanting to become a more holistic dentist?
Look, I think it depends. You know, holistic dentistry is, you know, there's lots of marketing out there. I know enough about it to know that, you know, I think I would probably be practicing holistic dentistry myself, you know, apart from maybe not offering oxygen every time. I definitely tell patients to have vitamin C, you know, after extensive amalgam removal. I always use rubber dam. I don't use a lot of metal in people's mouths. So look, I think it's just a term. I wouldn't get too hung up about, oh, I need to go work in a holistic practice to be a holistic dentist. I think you can, you know, you can definitely have an element of holistic dentistry in your day-to-day practice. And, you know, some patients come in for that. Sometimes the really, I guess, far off, you know, off the grid patients who really want the holistic dentistry can also be very challenging patients. So you've got to bear that in mind. I think when I was doing a lot of headache work, I was attracting some of those types of patients. And, you know, we all know people in pain are not able to think straight. You know, they're highly emotional. They may not have slept for a long time. So, you know, you've got to also know that that's who you're going to attract if you're going to be dealing with lots of headaches and, you know, all sorts of other people who are wanting that sort of dentistry. And it's probably very lucrative because it's a niche thing and not everybody markets themselves that way. But yeah, that's my sort of take and understanding of it.
So just be cautious and be informed as to what you might be expecting down the track if you're trying to dive into this a little bit more.
Well, I think just practice holistic dentistry to begin with. I mean, essentially always use rubber dam. You know, you should not be taking out amalgam fillings without rubber dam. So that's the first thing of being a holistic dentist. So, you know, aside from that, you can do a lot of research on it and definitely incorporate a lot of their holistic types of dentistry within your normal day practice or wherever you work. So, yeah.
So as a clinician, you know, we all reach a point where we start to contemplate practice ownership, being a specialist, or being a super GP, or maybe thinking about starting a family. Can you share your thoughts on that? For the majority of graduates in our demographics, they're, you know, female dentists. So I don't know if that plays a part into all of that.
Yeah, definitely. Look, I think I knew from a very early on stage of my career that I definitely wanted to work with other dentists. Like I'm a people's person, and I recognized very early on that dentistry can be extremely isolating. And, you know, often we have beautiful team members around us, but, you know, they're from a very different education level. So being completely honest, you know, like where do you get your mental needs from, you know, as a day-to-day? And we spend so much of our life at work. So knowing that, and also knowing that I wanted to keep improving as a dentist. And I feel when you work with others around you, particularly with a hygiene department, you know, it does push you more to keep improving and being the very best you can be. You know, there's like this unspoken subconscious element of like, someone else might see my work, oh my goodness, it's got to be like amazing, you know. I don't want anyone talking about my contacts not being tight enough or food traps that I've created. So I think knowing that, it was always an element of, well, what is the ideal in this situation? And, you know, of course, knowing I wanted to have a family too. So I have 3 children now. And even before I had the kids, I definitely considered practice ownership on many fronts, buying in, squatting, you know, all forms of it. I am a very practical person. So to be honest, I always ask myself, what is the reason I would want to own a practice? What would I hope to achieve? How would it change my life? And I think you've got to ask yourself that first. And, people do it for all sorts of reasons. I think being realistic, it's definitely not, oh, if you have your own practice, you're going to earn more money. Like, I think you've got to understand that to begin with, because that certainly can backfire. What are some of the other reasons? Control. Like, a lot of people want to be their own boss, they don't want to be told what to do, and clinical autonomy, et cetera, or maybe you can't find your ideal job, and you think, oh, I'll just create my own ideal job. And again, I think because I'm very practical, like I'm just sort of one of those, common sense is my, that's one of my strengths. And it was like, well, maybe I'll just find the ideal job instead of buying my own practice. So, I'm very happy with the stage of my career and the situation I'm in. I'm an associate. I work in 2 different clinics. I love both clinics. I'm very blessed. I have complete clinical autonomy. I have a lot of say and control in many aspects of the day-to-day dental life that, perhaps people, don't. So for me, I guess it's never really made a lot of sense. And, I'm not saying never, but also, I've been so blessed to be able to spend more time concentrating on my education. And I think a clinic within the female colleagues, it's like a child. We all joke like, oh yeah, I bought a dental clinic. Oh yeah, that's my 3rd kid, or that's my 4th kid. So, right now I don't want a 4th child. I'm happy with 3. And I think, there's realistically a lot of time and effort in running a dental clinic these days. There's so much to it. And so, that's one thing you can do, or you can spend more time with your family, or you can spend more time doing courses and getting, to do more fun clinical stuff. So, you can't do everything all at once, right? As they say. So you've got to just work out what's the most important thing for you and go from there. And I mean, half the workforce is female, if not more. So I think it's a really important question. And the other question is, if you were to buy it, when is a good time? Do you do it before the family? Do you do it after the family? And, I know, being this stage in my career, I know quite a few female dentists who bought their practices very early on and then had kids, and then they quickly sold the practice because they didn't want to have the headache of running a business and raising a family. So, I don't know.
Is it the headache because there are like family commitments that you have to make because of the time and all of that, and you might be in a relationship where you might be the breadwinner in that situation, but also you feel committed to I mean, I guess you can't speak on it, but I'm just asking for your colleagues that you talk to and why they sold the practice after they had their kids. Was there a particular reason?
Well, that's also a really good question in terms of your relationship dynamic. So, of course, if you're the breadwinner, then that changes things, because perhaps your husband is very involved in the practice, and there's situations where the husband is the practice manager, and there goes half your headaches, right? So, and sadly, that's the unfair competition that a female male dentist have, because often in that situation for a male dentist, the wife is often involved in the practice, so they have this default person to delegate things to, like, oh, you deal with the staff, and oh, you deal with the headaches. And so I guess as a female dentist, and in my relationship, my husband is very happy with his own career and has a very successful career, so he was certainly not going to give that up, or did I want him to give that up to become my practice manager. So that also makes a difference. And I think, I mean, if you're already in a relationship, then you probably can answer that within your relationship of, is this going to work for us as a couple? Can you really give me the time I need to run this practice? Because I also want to be a mother, and, being a mother is a full-time job. So it's like, how many full-time jobs can one person have? And still, be an amazing dentist and be an amazing mom, and, do all the things they want to do in life. But it's also about the number of days. When I did the maths, and I sat down with 3 different accountants, and I looked at it very closely at the time when I was thinking about buying into a practice, And, if you want to work 3 days a week, like it really doesn't make that much sense in terms of finances. So, 3 different accountants told me at the time, you'd be better off buying a restaurant. You're going to make more money through that than, buying a share of a dental practice and having the headaches to deal with it. So that was the advice I was given, and I took the professional's advice at the time. So.
Yeah. That's interesting. I mean, there's only more questions I want to dive into with that, but let's continue on with, with all the CPDs that you did, what was a particular game changer for your dentistry today?
Definitely the ortho, I think, and the communication, probably equal. I'd say one of the practices I was in, we used to do all these team stuff, the Prime, the Pride version is the American version. So, I started doing that many years ago, and then it sort of became Prime in Australia. So we did all of that. And, that was instrumental to ensuring that patients were coming back and patients were happy, and you could do ideal dentistry and you had full books, right? So, I mean, without a list full of patients, spending thousands of dollars doing a course and coming back to an empty book, like where's the common sense in that? So I guess that was all happening in the background. So I knew that confidently I could go learn new skills, and I had the patient pool to go and, do that sort of work on. So I guess that has to be happening. And if it's not happening, I think you have to take some ownership about it and make a conscious effort to work on your book. And, it's not the receptionist's fault. Like often I think dentists just don't want to train their team. And, they might, even as an associate, you might work somewhere and you give up and you think, oh, they don't know how to book properly and this and that. And, we've all been in those situations. But, I don't know, take some ownership, like spend some time training them. What do you want them to say on the phone? Do role plays, like what's wrong with that? That's just as important as going and learning an implant course. You've got to be able to have your team answer the questions on the phone when the patients ring up and say, does, Dr. S do implants? Like, what's your receptionist going to say? Have you taught them what you want them to say to roll it out? So yeah, I'm very passionate about that. I think without a good team around you, it's very hard to do headache-free, good quality dentistry. And I've seen dentists who do really good dentistry, but still, they can run into legal problems and other headaches because the team around them are just struggling. They don't know how to manage that day-to-day, that, in the dentist's head, they have the ideal, or maybe they don't. They wonder why it's so stressful. So I constantly spend time with the team. I'm very passionate about training and sort of finding out what it is they want to learn. And I'm always there, come ask, whatever it is. And often the new staff members might just get thrown in there and, they're too young or too embarrassed or too much ego, whatever it might be, to ask the right questions. Like, oh, I had a new patient call and they're wondering why it's so expensive. I didn't know what to say. They're not going to come to you like that. It's you've got to put your detective hat on and work out why people are not coming back if that's a problem you have with your books. So yeah.
That is interesting. As an associate, that you still just saying that yes, you have that potential to have an effect, and it's. You need to be hands-on about how you kind of approach it, especially when it comes to staff being, I guess, the first point of contact when a patient, either calls in, recalls, follow-ups with an appointment before they kind of get to you, right? So, interesting point, yeah.
Well, especially something like the Botox and filler course I did, for example. I mean, the staff had no idea. They didn't come to their very expensive weekend course or 4 days or whatever it was. So how would I expect them? How would I come back to my, clinical day and expect them to be able to help me roll this out? So, we spent hours explaining to them what we can now do. We started with educating them, and then, of course, saying, right, so, if patients call, if we're going to spend thousands of dollars marketing it, then let's nail the conversation you're going to have with them, because that's far more important than an advert or a fancy website. I mean, patients want to hear it from the people that work there. So, the better your team can talk you up, not even like to say how good you are, but to explain what it is you do as a dentist, you know, the more successful you're going to be. So I think every minute, every hour you spend on that just pays rewards, like unbelievable rewards for you down the track. And you can't measure it. And I think I've heard it so many times, dentists say, oh, why should I train her? She'll just leave and I'll have to, you know, train someone else. And I think that frustration, I do understand the frustration, and it's not easy being a dentist and having, you know, staff that come and go and they're so sometimes demanding. But, you know, my answer to that is, what if they stay? What if they stay 6 years and you still haven't trained them? Like, how bad is that? You know, so train them and hope they stay. And probably they'll stay more if they feel that you're bothering to invest in them.
Interesting. So, I mean, we talked about, you know, we're alluding to struggles that people have. Have there been any particular struggles in your particular CPD or dental journey so far that some of our viewers might not have known about?
Struggles as in not understanding courses, or what do you mean?
Yeah, either or, like, you know, in CPD or dental journey in general.
Look, I think back to motherhood, that's definitely the biggest struggle, if you're going to use such a strong word. And, you know, I'm a very positive person, so I don't like to use those negative words. But yeah, you know, I'd say challenge is probably a better way to put it. Definitely merging motherhood with keeping the sort of standard I want as a dentist has been challenging. Also, just dealing with different personalities. You know, I've learned a lot. I've been very blessed to work in great clinics. And, you know, sometimes it's also observing what it is that I don't ever want to do, that I've learned in some clinics. So, you know, yeah, we all have challenges, you know, challenges probably with dentists we work with staff, you know, rolling it out as to how do I stay the sort of mother I want to be and still continue my career the way I want it to pan out. And you know, I think you've just got to just go with what's in front of you. And I think you do have to keep going with your CPD journey. And actually, one thing I would say for, you know, parenting is, I did some of those lengthy courses when my kids were quite young. And at the time, I think, you know, people would have gone, oh, you're crazy. You've got an 18-month-old. What are you doing this? And all I can say is, once they're playing Saturday sport, you know, it's probably impossible to do those courses. If you've got 3 kids that need to be in 3 different places on a Saturday and a Sunday because of sporting commitment, like, it's not possible. So do it when they're young. Do it before you have kids, and, you know, learn as much as you can, because these days it's usually, you know, looking at when the course is on, that I would have to think about that first before I sign up to something. It's like, would this work for the family dynamics? You know, can I give 4 weekends in 6 months to this course? So that's a layer that comes into play as a mother making a decision about CPD.
Yeah, that's an interesting one that I haven't come across just yet. You mentioned a few different things there. If you don't mind me just diving into them a little bit more. So you mentioned that, you know, sometimes you're working with colleagues, the different struggles, whether it might be the senior dentist or someone that you're working with. How do you kind of cope in that kind of situation for someone that might be listening in that kind of situation?
Look, I think, yeah, if I was to reflect on my journey, I think you have to be realistic with what you can change in terms of where you work. So, you know, if you don't like the practice manager, you can probably sit on that and hope she'll resign eventually, right? If you don't like the owner of the practice, I think that's something, I mean, I shouldn't say you don't like. If you have tried your very best to make it work in that relationship with someone who owns the practice, and, you know, sometimes the situation is you start off somewhere and things are really good, and then someone buys into that practice, and that changes everything, because all of a sudden, you know, you've got 2 different bosses, and perhaps they're there for different reasons and different stages of their career. So all of a sudden, the challenges that you face as someone who works there just arrive without you having changed anything to do with you and your sort of clinical day. So I think reflecting on my journey, you know, if there involved with the ownership of the practice, they're not going anywhere. So if it's not working out, like, don't bang your head on a brick wall, move on. And you will never regret that decision, because life is too short to be unhappy with things you can control. And we can't control lots of things in our life, but you can control where you work, and that's just an easy thing. There is plenty of work around. Don't sort of think, oh, I can't see anything advertised. Go door knocking, find a practice you want to work in, and go knock on their door and say, listen, I want to work here. Is there anything available? And, they might say no, and say, well, how about half a day a week? And then, if you're good, you'll build it up from there. That's definitely, I think something you've got to be mindful for. Don't just search through CCADs or wherever you're looking for jobs. Go get what you want. Don't sit back and wait for it to come to you.
Yeah, that's an interesting point. Yeah, be a go-getter and don't try to just have it be served to you per se. So one of the things a lot of graduates want is mentoring. People interpret that differently. Some people say, I want to be held by the hand. Some people just want to be, checked in once in a while, whilst other ones just want to be a fly on the wall, and learn by observing. So what are your thoughts on recent graduates looking for mentoring?
I think that's a really important aspect to what you end up deciding, or where you end up deciding to work. And I think also, don't forget, the mentoring comes in different forms. So, reflecting on my journey, I'd say I took a lot of I gave a lot of attention to non-dental aspects of practice ownership as well. And I think, why is this person successful at running this business? What are they doing that's making them successful? Is it the marketing? Is it the people skills they have? Because look, we all know, sadly, lots of really good dentists are not successful at running a business. So they're sort of not the same thing at all. I think, if you luck out and you find a great clinical dentist who's also great at running a clinic, that's probably wonderful, and stick it out and learn both aspects. But, there's always a learning curve wherever you are. So, I think look for it. Don't just think, oh, this person does really bad dentistry, I've got to get out of here. Think, okay, well, maybe they're a really nice person. Maybe they've had a staff member there for 10 plus years. Like, what are they doing to have achieved that? And what can I learn in this situation? Because, I think there's lots of different layers of learning in dentistry. It's, as I've said, learning to deal with people is probably far more important than doing amazing crowns or veneers, because, unless you nail that first, there's probably not going to be a lot ahead for you to, book in your clinical day. Or what if you end up running your own practice and you never learn those lessons? You're going to have to make all those mistakes on your own staff and learn the hard way.
Interesting. So you're basically saying, look at the soft skills that the clinician that you're looking up to is doing. That he might not be saying specifically to you, but it's how he does things, or how he manages people. Manages might be not the right word, but how he communicates with other people around him to generate that successful vibe within the clinic.
Definitely. And I'd say, interesting enough, I've probably learned more from watching situations on what not to do than I have with what to do. And I think that's just life, that sometimes it's a stronger feeling that's created within you. So, I've definitely paid more attention to those circumstances where I think, wow, I can see that this is a situation I don't ever want to repeat in my journey with working with team members. And I think, you've just got to swallow the fact of, how integral the team is to your day-to-day. Like, you can't, put yourself apart and say, I'm the dentist, you're the nurse, and you listen to what I say. And, it will not work out too well for you. You've got to find those skills to make sure that they are fulfilled in their role too. And sometimes it's not, are they getting paid enough? I mean, that's something that you may not be able to control as an associate. And, it may not even be like, oh, I have to be so nice to them and suck up to them. It might be, what are you teaching them? Are you furthering their career? Like, is that what they want from you? Delegate. Like, they want to learn more. Some of the best nurses I've worked with, sadly, have left the sector because they've just felt that, they've reached a stage in their career at age 24 where, you know, they can't learn anymore. So they go and do hygiene or oral health therapy. But you just have to wonder, like, what if they were in a clinic where, you know, they could expand their wings a bit more? Like, would they have stayed? And that would have been such a good thing for our sector.
Yeah, that's interesting. And I guess as an associate, you have that insight into it because, you know, sometimes these staff members are a little bit more comfortable to talk to you about some of the things that they might be wanting to explore.
Definitely, yeah. And I've got more time. I think running the business day to day, you know, the bills, paying this, paying that, managing people, like, that does take it out of you. So, you know, as an associate, I think you have the luxury of time to step back and observe all that and just see what's working and what's not. And, you know, if you definitely want to somewhere down the track own your own practice, like, it is nice to learn all those skills. And of course, back to your question about the mentorship, I think absolutely it's good to work with dentists who are good clinicians, especially to begin with, because, you know, you're not going to do your best work if your margins are better than your bosses, like in year one or first year or second year out. But if you are in that situation, what I'm saying is, you know, maybe don't just quit, because there might be other things you can learn. Maybe stick it out and milk it for what you can. Learn as much as you can in all the other wonderful things they're doing well. And maybe help them, maybe say, let's go do some courses together. And they might be stuck in a rut, you know, they might just be so disillusioned with their career that they are looking for a young, fresh person to, you know, take them on a CPD journey. And why not? I mean, you know, it depends what stage of life they're at and how much ego they have, whether they'd be willing to do a 2-year ortho course with you. You know, if they're 50, why not? You know, what's stopping them? So, you know, don't think that their learning is not going to keep developing like yours is. So I think probably what you can't change is the sort of person they are. And I think we have to accept that in life. You know, you can never change your partner. You can't change who people are. You know, obviously if they're 2 years old, then sure. But, you know, by 25, 30, like, they are who they are. People don't really change. They might morph 10%, 20% this way, that way. But, you know, it is what it is. So that's my earlier comment. If things are not working with that personality and you've really tried everything, then perhaps that's when you do need to move on.
So who's been pivotal in your career path and why?
Look, that's a good question too. Pivotal in the sense of, look, I think some of my greatest mentors are probably women out of dental. You know, I think, you know, you're constantly searching for what has worked with other women who've perhaps had families and are still successful in their own way. And of course, success is defined in so many different ways. But, you know, it's, look, who am I thinking? I mean, there's always, you know, the CEOs like the Gail Kellys of the world, where you think, wow, you know, you run Westpac and you've got twins, and how did you possibly do this? You know, if I'm struggling with working 3 days a week and having 3 kids. So I guess it's those stories that I'm, you know, drawn to. They're the articles I love reading. You know, I love reading the news and the paper. It's probably how I spend my downtime, aside from spending it with my family, of course. So yeah, I'm always in tune of, you know, wondering how they got to where they got to. And I guess, you know, within dentists, I'm very mindful not to get drawn into, who's got the best before or after photos on Instagram, because there's a whole lot of other dentists out there who aren't posting, who are also amazing clinicians. And I think we've got to be aware of that. You know, it's also a generation thing, right? Like, obviously, you know, yourself included, you're all the tech savvy, posting, know how to navigate, all of that. Whereas, you know, there's still some amazing dentists out there. And just because they're not standing on podiums lecturing, you know, doesn't mean that they're not as good as the person lecturing. Their circumstances may be different, and that's why they're not lecturing. There might not be that sort of personality who wants all that attention. So, you know, I think it's just, you got to put it all in the mix as to who you're going to look up to. So, you know, I try and look up to all the people around me for what they're good at. And I think that's, you know, you can only learn from that. And, you know, there's always something to learn about humans. That's the beauty of psychology, I think, you know.
Right. So you're saying you've looked at your inner circle, and there's particular aspects about them that that you liked and that seem to be doing quite successfully at, and you basically just speak with them and then just kind of get their insight into how they're obviously trying to manage or get to that level, so that you can kind of emulate that kind of aspect incorporate that into your life.
Definitely. I think I would probably say I'm 5% of all the people I've worked with. If you put it all together, that's who I am, because I've taken what I can from every working environment and thought, I really like this, and I'm definitely going to continue doing it this way, or talking to people this way, or marketing this way. And then, of course, you sort of morph as a human on who you become. And working with people, of course, is a privilege of how closely you get to know them. Sometimes you spend more time at work than you do at home. You have these conversations in the lunchroom, and, you might do courses together. And they're all the fun memories I have of my career, of doing some of that with colleagues. And hence, back to the comment about working in a group practice is a real privilege, I think. And particularly working with hygienists, I think that's another point that I would highlight to a new graduate, that it should never be a competition of I can't give my cleans away to an oral health therapist and a hygienist, then there'll be nothing left for me. And of course, if you don't have a full book, then I can understand that thought train. But you can't start to do really more complex work because there's only so many hours in a day. So I would say I can count on probably two hands how many cleans I've done in the last 10 years. Like I have not done any cleans for so long. It's all done by the hygiene department that I work with. And, that's like a real, I honestly see that as a luxury, because not only am I freeing up my clinical day, but I'm also working on these incredibly healthy mouths that I haven't had to spend the time showing them the flossing and the brushing. Like how good is that? So I think probably beyond knowing how to navigate the relationships with your dental assistants and your receptionist, the other person that I spend a lot of time with is the hygiene department, talking to them like, so what did you think? What did you think about Mrs. Jones and the 3 crowns that she needs? Do you think next time we can, explain it to her in a different way? Why do you think she didn't make that appointment, etc.? So there's a lot there. If you work together, you can work together so well.
Yeah, that is interesting. Yeah, I guess for a lot of recent grads coming out to think in that, that mindset it's an interesting thought, because like you said, when you're not busy, you have this time to think. You're just like, oh man, like I'm not busy and they're doing the cleans, like I'm free right now, I want to do those cleans. But then to your point, it's like you've opened yourself up because now you can take on those more complex treatments that you're becoming more, you're building your knowledge towards, and you're becoming more proficient at. That's an interesting topic. So
yeah, I mean, it's definitely depends on the style of the practice. So I do a lot of checkups. So that's basically going into the hygiene room and touching base with people from, say 6 months or 12 months ago. And obviously that's where there's power in how good a relationship you have with your hygienist in terms of communication and the patient understanding what optimum dental care they, should be taking on for their dental journey. So if you don't have that relationship, of course, then you can be a matter of, well, why should I bother giving my cleans away? And what if that oral health therapist does all my checkups and I'll be left with no work? But you've got to get them on side, because it's a win-win too. Like if you give them work, then hopefully they can help you be able to explain things better to patients. It's often much more powerful for someone else to say to the patient, hey, listen, you really should do that orthodontic treatment that, Dr. X was talking about, because look at all the wear you have on your teeth, because you're not the one who's doing the treatment. So patients actually take that more seriously in some ways, because they're like, oh, well, this person's not actually benefiting from it, so maybe I should listen to what they're saying to me. So I think you've got to just, understand the power there once you've got your relationship working well.
Well, Well, there's already more questions I want to ask you, but just to wrap it all up, what would be any words of wisdom you would give to the budding young dentist who's kind of graduating at the moment?
I think don't sit around. Like, if take ownership on your book and make yourself busier, because there really should be like an internship for dentists. I think looking back, the first few years you're so hungry and you probably don't really understand the level of risk for doing a lot of procedures. So in some ways you just dive in and do more. As you get older, all the colleagues my age say this, that you become more risk adverse because, you sort of see things that have gone wrong with yourself or others. So you don't just dive into things the same way, you're more cautious. So I think initially it's a real waste if you're sitting around because you probably have time, you don't have family yet, and just try and get as busy as you can, whatever it is you have to do. If you have to do those checkups and cleans, do them. Build the relationships with your patients, get them to come back. Take ownership when they go out to the front and they don't book the 6 months appointment that you've suggested. Ask yourself why. Like, do they not understand your gum disease discussion, or did you not train your receptionist to make them book better than how it worked out? So I think that's probably the first thing to work on, and whatever it might be, that might be more communication courses. You might be taking your receptionist out for lunch every once in a while and saying, what are patients saying? When I leave them at the desk with you, like, why do you think they're not booking in for the fillings that I'm suggesting, or the crowns, or whatever you're communicating to your patients, and take their feedback. Like, who better than them to tell you, well, maybe like they don't think they need the crowns that you're telling them that they need, or, whatever the feedback might be, and learn from that. Just drop their ego. I think that's probably the first thing. A lot of dentists come out, and of course, we spend the hard years, perfecting the skill of dentistry, and of course it comes with ego that I'm better than everyone, I'm the best dentist there is, I'm better than the nurse and the receptionist, what do they know, they didn't go to uni. And it's like, yeah, it's probably not going to get you far having that sort of attitude. So work with people.
Yes, definitely. We're definitely still in the people's business, aren't we? So, Dr. Sandra Pedram, thank you for coming on the show today. If you can let the people know how they can find you or what you've got going on in your life.
What was that, sorry?
How they can find you or what you've got going on in your life.
Yeah, so as in how they can contact me.
Yeah.
Yeah, definitely. I'm on all the platforms, Instagram. I've got my own website as well. So drsandrapedram.com.au, because I work in the two different practices. It's just a lot easier having sort of, what I do on a website. So yeah, definitely. I'm happy to talk to anyone who, wants to find out more about any of the courses I've done, or, advice on practice situations I've been in. Absolutely. I think, as colleagues, we really should be supporting each other more and never, ever throwing each other under the bus. I think that's just the worst thing any dentist could do, is to put another dentist down. Even if the thought is in your mind, just never say, what dentists don't understand when they do that is, the patient doesn't think, oh, I want to come to you because you're better than the last person. The patient thinks, I don't trust any dentist now because the last one was a dodge and you're going to be no better. So we're actually losing people to all dentists by doing that. So, yeah.
So we'll definitely leave those in the show notes below so they can definitely get in reach with you. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.
Thank you.